Hi guys, so today I'm going to be talking about the healthcare system in Japan. So here's my introduction video.
The Mutual Insurance Model by Otto von Bismarck explained. In 1873, the German Chancellor Otto von Bismarck created the world's first welfare state. He introduced the Mutual Insurance Model, making it mandatory for all. The plan was to head off the upcoming socialists who were organizing themselves with all sorts of workers' health plans. Under the Mutual Insurance Model, every working person contributes part of their income to a central fund, and if someone becomes sick, they're able to claim part of the costs back from this mutual insurance fund. Nowadays, these mutual insurance funds are still used in several countries, such as Austria, Belgium, the Czech Republic, Estonia, France, Germany, Liechtenstein, Luxembourg, the Netherlands, Switzerland, and Outer Europe, Israel, and Japan. The funds all work differently, but operate on the same basic principles, where you're free to choose your doctor. You pay for your treatment and then get reimbursed for part of the expenses by your mutual insurance fund. Reimbursement rates can vary between countries, as not every reimbursement system is the same. If you would like to receive full reimbursement for your medical expenses, you may want to take out an additional private health insurance to fill the gap.
Okay, so now I'm going to be going over the general background of the Bismarck model. It kind of covered this in the video, but I'm just going to go a little bit more in depth. So the history of the Bismarck model is actually pretty interesting. So it started with this guy shown on the screen named Otto von Bismarck, and he was the Chancellor of Germany, and he implemented the Bismarck model in the late 19th century due to the social and political challenges that Germany was facing during this time. And it was first called the Universal Sickness Insurance. And then eventually this extended to the entire population of Germany. So Otto von Bismarck recognized the need to improve social conditions and secure support for the working class. So what is the Bismarck model? The Bismarck model is a healthcare system where people pay a fee to a fund that pays for healthcare. The Bismarck model uses an insurance system and is usually financed jointly by employers and employees through a payroll deduction. Unlike with the U.S. insurance industry, the Bismarck-type health insurance plans do not make a profit and must include all citizens. This can be provided by state-owned institutions, other government body-owned institutions, or a private institution. Bismarck systems usually have way higher accessibility, shorter wait periods, and higher quality and more consumer-oriented healthcare. So unlike the beverage model that some other people might explain in this class, the Bismarck model doesn't provide universal healthcare. It requires employment for health insurance. So it allocates its resources to those who contribute financially. Next, I'm going to cover the Bismarck traits. So first, we have universal insurance. Nobody is denied insurance based on their inability to pay or their health status. And this is either through an employer plan or through the government. Next is community rating. So everyone pays the same amount, and insurance is financed through taxes, not premiums. And the rich and healthy subsidize the poor and sick. And finally, the insurance system operates under managed competition. And then finally, we have regulated private healthcare provision. So many hospitals are private, and physicians operate privately. They're not direct employees of the government, but the prices are set by the government in negotiation with the providers. And finally, private providers do not have the option of offering services at higher or lower prices. Japan applies the Bismarck model through a system of mandatory health insurance, as I said before. Employers and employees split the costs, and everyone gets the same level of care. It's a balance of contributions and benefits. In 1958, Japan passed the National Health Insurance Law, universally guaranteeing insurance to citizens. Next, I'm going to talk about the concerns or problems that the Bismarck model might create. So while the Bismarck model of healthcare has its merits, it also comes with some challenges and issues. So the first is dependency on employment. The Bismarck model requires employment for health insurance, so it allocates its resources to those who contribute financially. One of the main issues is how to provide care to people who are unable to work or those who can't afford those contributions, including aging populations and even people who are retired. Since the financing of the Bismarck model is tied to employment through payroll taxes, this will create issues with individuals who are unemployed, self-employed, or in other non-traditional work arrangements, which could lead to faults or gaps in the coverage. Also, these mandatory employment taxes are not cheap. Next, there are limitations to medical expenses. So the focus on low costs and efficient care means that there are fewer healthcare services available for citizens living in rural areas. Also, doctors cannot choose how much they want to charge for their services since the government chooses how much their service costs. So doctors really can't get paid a whole lot. And then next, here is another video.
Japanese citizens go to the doctor on average of 15 times a year. Insurance covers everyone for everything. After a fractional co-payment, the visits are basically free. Even for the elderly, long-term care and nursing homes, even home care is covered. The Japanese have a life expectancy of nearly 83 years, compared to 78 in the United States. Gerald Anderson of Johns Hopkins was in Japan to study the healthcare system earlier this year.
When they go to the doctor, it's a free service. They might pay a few yen, a few dollars for the care, but pretty much it's a free service. They can go to any doctor, they can go to any specialist that they choose. There is no gatekeeper, there's no one telling them that they have to go to this doctor.
There are about 5,000 insurance plans in Japan, all with practically identical coverage. About 1/3 of the population pay for health care through salary contributions, 4.5%, matched by the employer for a total of 9% of salary going to health insurance. People who are self-employed or with smaller companies also contribute through earnings. Coverage for public officials is identical. The government picks up the tab for people who do not work and those over the age of 70. Japan spends 8.1% of GDP on healthcare compared to 16% of GDP in the United States. Total annual spending $2,581 per capita compared to $7,290 in the United States. There is a single reason why Japan can pay for such extensive benefits, according to Mei Chen of Princeton, who specializes in Asian healthcare systems.
The government sets the fees, and then there's only one fee schedule for the whole country, so everyone, all the providers, doctors and hospitals live within that set of fees. And this is in fact the perhaps most powerful cost containment tool for the health system in Japan.
22% of the population is over the age of 65. The birth rate is negative. In that respect, Japan is expected to struggle to provide generous coverage with fewer people in their working years. Kitty Pilgrim, CNN.
So here are some of the comparisons between Japan and the other countries that use the Bismarck model. So Japan's obesity rate is 4.3%. Their average life expectancy is 84. The infant mortality rate per 1,000 births is 26. And current expenditures in health per capita in US dollars is 4,388. So I'm not going to name all the rest of the ones because I feel like that would take a really long time. So you guys can just look at it and you can see from this that the obesity rate is really low in Japan compared to the rest of the countries. Their life expectancy is much higher and their infant mortality rate is much lower, and they spend a lot less money compared to the rest of the countries. So both Japan and Germany use a version of the Bismarck model for healthcare, meaning it's mandatory and costs are split between employers and employees. However, there is a key difference. In Germany, wealthier individuals often opt for private insurance, which can offer faster service and more personalized care. In contrast, Japan's system is designed to provide the same level of care for everyone, regardless of income. The healthcare system is more uniform, and also Japan has strict government price controls to keep the healthcare costs down, whereas in Germany there is a bit more flexibility in pricing. The next comparison is France. So France also uses a form of the Bismarck model like Japan, where insurance is mandatory and premiums are split between employers and employees. French healthcare is more centralized, with the national government playing a big role in setting prices and determining policies. On the other hand, Japan's healthcare system is more community-based, with local governments playing a significant role in managing and financing healthcare. Additionally, in France, there is a larger private sector presence in healthcare compared to Japan. This means that people in France have the option to choose private healthcare services, similar to Germany, which are often more expensive, but they offer shorter wait times and more personal care. In Japan, everyone gets the same level of care regardless of their income. Next, we have Belgium. So once again, Japan and Belgium use the Bismarck model with universal healthcare, but their systems have different focuses. So Belgium, like Germany, has a dual public-private system. This allows people to choose between statutory health insurance and private health insurance. In contrast, Japan's system is more uniform by providing the same level of care for everyone. Once again, Japan uses strict government price controls to keep healthcare costs down, while Belgium has more flexibility in pricing. So Japan and the Netherlands have universal healthcare systems, like I have said for the past ones. In the Netherlands, healthcare insurance is mandatory, and it's a mix of private and public funding. Everyone pays into the system, and in return they receive a basic package of healthcare services. On the other hand, Japan's healthcare system is uniform. They provide the same level of care for everyone, regardless of income. Additionally, Japan has strict price controls to keep healthcare costs down. So while both countries aim to provide healthcare for all, the Netherlands offers more choice in terms of insurance providers and plans, while Japan focuses more on equity and cost control. So next, I'm going to go over the cultural differences throughout Japan. So Shinto and Buddhism are the two main religions in Japan, and many Japanese people practice a syncretic blend of both. In addition to these, there are many other minority religious groups and new religious movements. There are also many different ethnic groups in Japan. While the majority of the population is ethnically Japanese, as you can see in my pie graph, there are also minority groups with diverse backgrounds, including Koreans, Chinese, and Brazilians of Japanese descent, and Peruvians of Japanese descent. In the 20th century, there was a significant migration of Japanese to Brazil and Peru for economic reasons. In more recent years, some of the descendants of these Japanese immigrants have returned to Japan for employment opportunities. Japanese culture places a strong emphasis on preventative healthcare. There is a proactive approach to maintaining health through practices such as regular physical exercise, a balanced diet, and a overall healthy lifestyle. This cultural value contributes to Japan's relatively low rates of certain lifestyle-related diseases. Practices such as meditation, mindfulness, and participation in communal activities are valued for their positive impact on mental health. The cultural emphasis on maintaining harmonious relationships and social connections also contributes to an overall emotional well-being. Traditional Japanese medicine such as Kampo and acupuncture often complements Western medicine. There is a recognition of the importance of a holistic approach to health, addressing both physical and mental well-being. Many individuals may incorporate traditional practices alongside modern medical treatments. Next, cultural attitudes toward death and dying often influence end-of-life care. Traditional practices such as respecting the deceased and observing rituals may play a role in shaping how healthcare providers approach end-of-life discussions and palliative care. So here are some examples. So the Ainu culture is the indigenous people of Japan residing in Hokkaido, and they have their own unique cultural practices, including traditional medicine and healing rituals. Next, the Filipino community in Japan, including both permanent residents and migrant workers, may have distinct healthcare practices and preferences, cultural considerations, and language diversity. LGBTQ+ individuals in Japan, as in many other countries, may face specific healthcare concerns related to stigma, discrimination, and a lack of understanding. Culturally sensitive healthcare practices that respect diverse gender identities and sexual orientations are essential. Finally, Japan citizens of Korea and Chinese descent, as well as recent immigrants from these countries, may have cultural practices that influence their approach to healthcare. Language barriers, cultural differences, and potential discrimination can impact healthcare access and communication. The culture of respect for authority is deeply ingrained in Japanese society. Patients generally trust and respect their healthcare providers, following their advice and recommendations. This relationship is built on a sense of trust, which is crucial for effective healthcare delivery. Patients may be more deferential to healthcare professionals, and it's important to reciprocate with a respectful and polite demeanor. So, what can professionals do to respect these cultures? Respecting Japanese culture in a healthcare setting is crucial for providing culturally sensitive and effective care. And here are some of the ways to do so. So first, I believe that healthcare professionals should undergo cultural competence training to understand the values, beliefs, and customs of Japanese culture. Next, they should learn about the cultural nuances related to health and healthcare seeking behavior in Japan. They should also make an effort to learn basic Japanese greetings and common medical phrases. While Japanese people may speak English, especially in urban areas, using some Japanese phrases can demonstrate respect for their language and culture. This also helps to ensure proper communication and that your message is sent and received properly to the patient. You should also be aware of nonverbal communication cues such as bowing, which is a common gesture in Japan. Respect personal space and be mindful of body language. Next, recognize the importance of family and Japanese culture. In healthcare decisions, involve family members when appropriate and respect their input. And finally, Japanese individuals often value privacy and modesty. Ensure that healthcare practices and procedures respect these values and provide appropriate privacy during examinations and discussions. So the personal space that is commonly referred to in Japan is 2.5 to 3 feet, and 99.2% of people in Japan have Japanese as their first language, and there are still a few lesser spoken languages across the islands. So physical contact, Japanese people prefer minimal physical contact, and they tend to avoid touching others unless it's unavoidable, like in crowded public places. And here are my sources. Thank you guys for watching. Bye!